That's my pleasure.
Our second speaker is Dr. Moaz Mohammed, who also
Yeah.
comes from a center that I really, really admire, the Yeditepe University Hospital in Istanbul, Turkey. Now, Yeditepe means seven hills or seven mountains, and this is the name often given to Istanbul. And this university hospital is also a state-of-art place where, again, I had the pleasure to visit and also attend a few of the cases in the operating room. Dr. Moaz Ibrahim Abdullah is an assistant professor of neurosurgery and neuroanatomy um, and a fellow at this university hospital, and he will be talking about cross-sectional and surface anatomy of medulla oblongata. So welcome, Dr. Moaz, and thank you very much for doing this.
Thank you very much. Okay. Hello? Hello. Now my voice is clear?
Yeah, good now.
Okay. Okay, now it's good.
Yes,
No,
perfect.
clear.
Make
Clear.
it a full screen.
Thank you. Sorry
Press
for the
presentation mode.
yeah, okay. Thank you for this
Yes,
delay.
perfect. Now it's perfect.
Yeah, hello everyone. And thank you for this kind invitation. I will try to show very briefly the external feature and cross anatomy of the medulla oblongata. Just I will start here with the historical aspect. So when we mention the medulla oblongata, we have to remember the Herophilus of Chalcedon. The Herophilus of Chalcedon is the father of microneurosurgery. So Chalcedon is a modern day Kadikoy. Kadikoy is a city in Istanbul where I'm living now. And from here also, I want to send special thanks to Professor Abuzer and Professor Toure for giving me nice chance to participate in this fellowship. So the Herophilus start searching the soul of human. And he said the soul of human is located in this area, the blue area. And called this area is Calamus scriptorius. So Calamus means the reed pen. At the ancient time, when you used to write everything, so they call it reed pen or Calamus scriptorius. When we came to the external feature of medulla oblongata, I will try here to show my own dissection, which I did here in Yeditepe laboratory. So as Professor said before, I will just remind, the external feature very briefly. As we know, the brain stem consists of main three structures: midbrain, pons, and medulla oblongata. Midbrain separated from pons by pontomesencephalic sulcus, and you have third cranial nerve here, emerge at the level of superior colliculus, and you have fourth cranial nerve emerge at the level of inferior colliculus coming from back, and you have here trigeminal nerve located in the mid pons, comes out and anterior lateral to the pons. When we come here to medulla oblongata, okay. When we come here to medulla oblongata, we know that the medulla oblongata is starting here at this point, at the between the pons here, at the level of pontomedullary sulcus above, and down here at the level of pyramidal decussation here. So this pyramidal decussation at the level of first cervical root. The importance of this point, because the all tracts at this point it change their direction. So it's important to know where is the lower limit of medulla oblongata. Here we have the median sulcus. Just lateral to median sulcus, we have these two important structures here, the pyramid. Above the pyramid, there is the pontomedullary sulcus, and lateral to it, we have sixth cranial nerve emerge here. Lateral to pyramid, we have this oval structure, the olive. Between the olive and the pyramid, we have anterior olivary sulcus, in which the 12 cranial nerve, hypoglossal nerve comes out here, between the pyramid and olive. Just superior to olive, we have the supraolivary sulcus, in which 6 cranial nerve, as we mentioned, appear, and 7 and 8 cranial nerve here in the supraolivary sulcus. This lateral view showing the posterior part of the olive. In the posterior part of the olive here, we have posterior olivary sulcus. This area for me is very important area, located between the olive and the lower cranial nerves, 9, 10, and 11. Because in this area here, we find, when we dissect this area, we will find a lot of tracts. The most important tract is ventral spinocerebellar tract. And we have also spinothalamic tract. So all anterior lateral system is located here in this area. It's not just like a posterior olivary sulcus. So if we see here, as I mentioned, we have a pyramid, olive, 6, 7, 8, and lower cranial nerves. In this area, just lateral to lower cranial nerve, we have the inferior cerebellar peduncle is located here. So if we put them in order again, we have the pyramid here, and here we have anterior olivary sulcus, we have the 12 cranial nerve emerge, then we have olive, then we have posterior olivary sulcus, and we have supraolivary sulcus here. Posterior to it, we have the Gower's tract, the ventral spinocerebellar tract, we have the spinothalamic tract, all of them located here. Then we have lower cranial nerve, 9, 10, 11 cranial nerve. Posterior to lower cranial nerve here, we have the inferior cerebellar peduncle. It has two faces. Here, the lateral part of inferior cerebellar peduncle, and also we have a posterior part. We will see it when we discuss the fourth ventricle. This one of my dissection. I showed here the 6 cranial nerve coming and going lateral to the corticospinal tract. Here is the corticospinal tract. Here is the 6 cranial nerve coming and going lateral to it and superior to the olive in supraolivary sulcus here. I start to dissect and I remove the lamina over the medulla oblongata on the lateral surface here. I showed here the corticospinal tract going down. Then I showed the anterior olivary sulcus and the olive nucleus. And I showed here this part of this tract. It's difficult to differentiate the ventral spinocerebellar tract from the spinothalamic tract. But all of them located here, just posterior to the olive. And also we have this very important structure, external arcuate fibers. External arcuate fiber originate from here, from the nuclei located anterior to the pyramid. We call them arcuate nucleus. This arcuate nucleus is the part of pontine nucleus. During embryology, part of this pontine nuclei descend down here and send the fiber through the external arcuate fiber to the cerebellum. So we call it external arcuate fiber, located just lateral to the corticospinal tract and lateral to the Gower's tract here. Also, we have here the dorsal spinocerebellar tract. Here, we have ventral here and dorsal spinocerebellar tract. It comes up and joins the inferior cerebellar peduncle to go to the cerebellum. Also the same, in this dissection, I showed here the external arcuate fiber, starting here in the nuclei here. It's difficult to show it, but it originates from here, anterior to corticospinal tract, then going lateral and going up to the inferior cerebellar peduncle. Here we see the ventral spinocerebellar tract on the right side. It goes up and come down through the superior cerebellar peduncle, while the dorsal spinocerebellar tract going up and enter through the inferior cerebellar peduncle. Also, in this dissection, I remove the Gower's tract and ventral spinocerebellar tract, and I showed parts here of reticular formation fiber, or sorry, nuclei is located here. It's difficult to distinguish. And also just lateral to the ventral spinocerebellar tract. After I remove it, I show the spinal trigeminal nucleus. It's located here, if we follow it like this. We have the lower cranial nerve fiber, and also it's very obvious the dorsal spinocerebellar tract going down and goes here to the inferior cerebellar peduncle. Fifth cranial nerve, also the same as I mentioned. In this dissection, I dissect the right and left side of the brain stem. And here, especially the medulla oblongata here, as I mentioned before. Here at this level, I showed the medial lemniscus up. Here I show the same pyramid, inferior olive. Here I showed the trigeminal nucleus here. This structure here is the central tegmental tract. Is wrongly, I wrote it, but here's the central tegmental tract. So central tegmental tract coming from the right nucleus down until the inferior olivary nucleus. In this side, in the right side, I showed this fiber is not clearly obvious, but this fiber is the olivary cerebellar tract. It's coming from the contralateral olive and going to the inferior cerebellar peduncle. Is here, olivary cerebellar tract. In this dissection, I removed the whole corticospinal tract. On the right side, I show the medial lemniscus, as you see here. Medial lemniscus coming from the back from the cognate and gracile nuclei is decussate and coming up as the medial lemniscus going upward, continuous up to the thalamus. Also here is very obvious the inferior olivary nucleus. Also central tegmental tract is very obvious coming here. It's very important tract. And also here olivary cerebellar tract crossing up, and this is trigeminal nucleus. Here also I cut the eighth cranial nerve. I show this is the vestibular part of eighth cranial nerve, and this is small fiber here, the cochlear part of eighth cranial nerve. Here's the inferior cerebellar peduncle going up from the medulla. This is the dorsal spinocerebellar tract. Here's the also join some fiber from occipitocerebellar, olivary cerebellar tract. Join here to form the inferior cerebellar peduncle. Here I cut it, I show the dentate nucleus from posterior. If you notice here, the trigeminal nucleus coming down and goes just medial to the dorsal spinocerebellar tract here and emerges again here. So it starts from here. This is the trigeminal nucleus coming like this, and appear here again. Also, this very important tract is olivary spinal tract is going down here. Here's the C1. When we come here to the fourth ventricle, this is before dissection. As you know, the fourth ventricle, this area we call it rhomboid fossa. So it divided into two parts. The upper part formed by pons, the lower part formed by medulla. And here's the intermediate area. Mostly there is this trimedullaris located here in the fourth ventricle. The lateral border, we have the gracile tubercle here. We have the vestibular nuclei here. In the right side of this dissection, I remove also the lamina, and I showed all of them. If we come from up downward, we will see here first the facial colliculus. I just showed here the 7 cranial nerve going around the 6th nucleus, abducent nucleus here. Also, I showed here the superior vestibular nucleus. We have stria medullaris here. As the medulla here, we have hypoglossal triangle here. Just lateral to it, we have the vagus triangle. And this gray area is area postrema. Just between the area postrema and the vagal trigone, we have this structure we call funiculus separans. It's like a cord structure separating the vagal trigone from the area postrema. We have here gracile tubercle, we have cunate tubercle, and we have gracile fasciculus and cunate fasciculus. I showed all of them. On the lateral side here, we have this structure, is restiform body. So restiform body is the part of inferior cerebellar peduncle, contain most fiber of the dorsal spinocerebellar tract and part of accessory cuneatus nucleus tract. Here we have dorsal cochlear nucleus here, located posterior to it. Also in this dissection, I showed also the same part of them. As we see here, this is a restiform body. We have here gracile nucleus. We have here cunate nucleus. The same. When we came to the cross-section anatomy of the medulla oblongata, the most common book that we use to get the anatomical information, for example, like the human central nervous system book, if we see this is a cross-section of medulla, and also the same. But when I start to dissect, Professor Torres told me very important things. When we start to study the medulla oblongata, we will see always the direction of the MRI is totally different from the direction of the box here. As we see, we will find here the pyramid is directed down, while in the MRI, the pyramid is directed up. So before we start dissection, first I change the direction in all the book of Riley. If we see here, I change also, I used Photoshop to change all this letter to be up like this, to be matched with the MRI, like a pyramid here and olive here. Then I start to dissect. Okay, in this cross section is lower down in the medulla oblongata at the level of pyramidal decussation. I cut this area. As we see here, the corticospinal tract like this. And this yellow area is just the decussation area, like here. Here, this yellow bar is correspond to the fasciculus gracilis is here. And this correspond to fasciculus cuneatus. Here, this area correspond to the to the trigeminal nucleus or spinal trigeminal nucleus here. Here correspond to the accessory nucleus, the spinal, to the cranial accessory nucleus is here. This cross section above at the level of sensory decussation or at the level of the gracile cunate. So as we know that the gracile fasciculus and cunate fasciculus go up to the gracile and cunate nuclei, then they form the internal arcuate fiber, then they go up as the medial lemniscus. So this section just below the decussation of the internal arcuate fiber, the same. Here the corticospinal tract as here. Here the lower part of inferior olive. Here is the medial meniscus fiber going up, as located here. Also the same nucleus of nucleus gracilis and nucleus cuneatus located here. Also the same is trigeminal tracts. This section at the level of mid-olive. I just cut the brain stem or the medulla at the level of mid-olive here. As we see here, the corticospinal tract fiber is the white fiber, as here. Also, we have here the olive nuclei, inferior olival nucleus. Also, we have medial meniscus is located here. Here in this lateral side, we have the ventral spinocerebellar tract or Gower tract with the spinothalamic tract is located here. Here located. Here we have the inferior cerebellar peduncle located lateral, as here is the restiform body. This section. And we have here trigeminal nucleus again, located here. The whitest area here. We have here vestibular nuclei, is just medial to the inferior cerebellar peduncle or restiform body, located here. We have here this red area. Red area here is the vagal trigone here. It's just a little bit lateral. And the most medial, we have hypoglossal nucleus is here, located here. This fiber tract we use usually for Professor Toure before operation, just to locate the tumor site. To locate the tumor site. For example, here's the tumor. Here's the whole fiber inferior. For example, here inferior cerebellar peduncle going up. Also, here's the superior cerebellar peduncle, the pink one. The yellow one is the inferior cerebellar peduncle. The green one here is the middle cerebellar peduncle. The red one is the corticospinal tract, and the blue one is the medial meniscus. So usually he uses 5 tracts: superior, middle, inferior, and medial meniscus, plus inferior cerebellar peduncle, plus corticospinal tract. Finally, I would like to send a special thanks to Professor Abu Zer, our director, and Professor Oger Toure, our mentor, for giving me this special opportunity to observe his operations and to do all these nice dissections. This photo last year when Professor Eshergil visited us last time. Thank you very much.
Thank you very much, Dr. Moaz, for the nice and excellent presentation on the cross-sectional and surface anatomy of the medulla oblongata. So now we are coming to the audience. Anyone from the participants further ask any question? Any questions from the participants?
I think there's no questions. The presentation today was very clear and very thorough, and we have very nice informations, and we see very nice dissections and very nice pictures of the anatomy. So thank you, Dr. Moab, and thank you, Dr. Prakash, for these wonderful presentations.
Thank you
Dr.
very much.
Shahzad, Okay. Dr. Shazad, please, if you have any final remarks.
No, Dr. Moaz, I loved your presentations, and I really liked the way you used dissection models and um, uh, how you showed the different white matter tracks on your slides. And I'm very sure that all the students in the audience must have appreciated this. And I would also like to thank Ahmed Saleh for organizing this wonderful activity, Dr. Sohail Ahmed for being the moderator, and of course our two speakers, Dr. Maud and Dr. Prakash.
Thank you, sir.
Thank you very much, Dr. Shazad, for your nice words. Dr. Sohail, if you have any closing remarks.
I have seen the program layout is very interesting and very informative for the neurosurgeon trainees and the young neurosurgeons regarding the neuroanatomy topics. So I'm very thankful for Dr. Moaz Moman and Dr. Prakash for the nice presentations, and Dr. Shahzad Shami Saab and Dr. Ahmed. Thank you very much.
Thank you very much. Thank you.
I guess if there is no more questions or no comments, we can conclude today's sessions and see you all, inshallah, next Friday with more presentations and more speakers. So see you all, inshallah, next week. Dr. Shahzad, please, final word.
Yes. With that remark by Dr. Ahmed Salah, we will now conclude this session, and thank you very much, everybody. Please do send your comments because your comments are invaluable in improving our presentations and improving our content. So please do share your feedbacks. So with this, we will conclude our session. Thank you very much, everybody.
Thank you.
Thank you, sir.
Thank you.